Yeah, so I'm Lynn from Just Women Live, and
I'm
this is
Sophie. Nice to meet
Sophie.
you all
So we
again.
are introducing Dr. Olivia Hum, who came to speak at Just Women Live event back in March, but she was so popular that most people's mouths dropped and they couldn't get enough of her. And unfortunately, didn't have enough cards, so we brought her back on the podcast because we'd like to re-listen to some of those stories and obviously have somewhere where we can our viewers and all the people who came to these events can actually get in touch by email or make an appointment to come and see you.
So today we're going to talk about menopause. And yeah, over to you, Lynn.
Okay, so tell me a little bit about what's happening during the perimenopause and menopause. What's actually happening hormonally during perimenopause and menopause?
And we kind of talk about menopause as a time of transition, really.
Yeah,
So, actual menopause is just your last period. That's your last ovulation.
yeah,
And that's when everything stops. So, after menopause, you stop making the female hormones estrogen and progesterone,
yeah.
and the levels gradually over the next year decline to nothingness. And so, that's menopause. And that's usually quite easy to define, although for many of us, we'll never know when our menopause is because either you've had a hysterectomy or you might be on hormonal contraception. So, you just won't know. Perimenopause is much more difficult to define. And I've been in sort
Right,
of high level meetings in which people have just been arguing all the time about what it actually means. So it used to be the year before your period stopped. And
right.
what happened is that your periods would space out and you'd have 2 or 3 months between periods and you get some hot flushes. And that was perimenopause. But now we know that women often can start feeling the changes of this transition, even up to 10 years before their actual menopause. So
Wow.
often in our
10
clinic, we see
years.
women in their, yeah, 10
So
years. I
about
know it's mad.
40.
So we see women in their
About
late
40,
30s.
late
Yeah,
30s.
absolutely. Yeah. So we
Okay.
know that 5% of women will go through menopause under 45. So if you start changing 10 years before, it's quite conceivable that you start having symptoms in your late 30s, although
Yeah,
So,
most women don't. Most women, it's your 40s.
mm,
right. And after menopause, menopause can last up to 10 years, can't it?
So this transition can last for up to 10 years. So whether you get symptoms or not, and when you get them is really individual. So
Yeah, of
some women will
course.
get no symptoms. For other women, they will get symptoms from the beginning of their 40s.
Yeah,
Other women, it won't kick in until 1 or 2 years after menopause. So everyone is really, really different.
so what's the earliest sign most overlook or don't connect to hormones of the perimenopause or menopause? What are the classic early signs of you heading towards your
Well,
menopause?
brain fog?
so it's really hard because again, we know that your
Different
Everyone's
40s is a
people.
different.
really difficult time. There's loads of other stuff going on as well, isn't there?
Mm.
So,
Stress.
often women have got quite young children. They might even have
Mm.
toddlers, it's in their 40s. They've got, they're working and often
Yeah.
at quite a high level. This is where you kind of reach the peak of your career. Your parents are starting to get older.
Mm.
You've got all this other stuff going on. And you are also then your hormones start changing. So for often the first sign for women is a really subtle sort of alteration of their cycle. So they might start, for instance, their cycles might get shorter or they might become more erratic. So women will say, I've always been a 28-day kind of cycle person. And now 1 month it's 31 days, the next month it's 25 days. I'm still having a period every month, but it's
But
just beginning to alter. And that's because the body is detecting that your egg supply is beginning to run out. So it is
right.
putting in lots of desperate kind of hormonal things to try and desperately require get you to become pregnant before it's all over. That's what it's there for. That's what all these hormones are trying to do.
Right.
That's the plan. Um, for some women, that whole process goes on and they get no symptoms. But for
Mm.
others, this sort of hormonal instability as your hormones go very up and down can give them lots of different symptoms. And again, it's very, very individual what women will present with.
Yeah, that's
Exactly.
interesting, isn't it?
Mm. So
Um, sorry. Uh, sorry, I was going to ask. So, so obviously you'll get different symptoms depending on the person. I remember I got some very strange leg aches, which I think
I've
were
had that.
partly to do with it, and aches and pains, which I wasn't expecting at all. But why is this stage of life so often missed or delayed in diagnosis? Because I think I was quite lucky because I was told that I was going through perimenopause quite early on because I was getting these weird leg aches. But I imagine if you weren't having symptoms, you wouldn't necessarily know. Um, so so why do you think that it's so often missed, as in when
Well, I
you're
don't suppose it's I think the fact is that because medically we've always thought of perimenopause as this year before your period stop, there's very little actually about perimenopause. So there's nothing really written about it. There is no real guidance on it. All the medication, the HRT that we use is licensed for postmenopausal women, not for
Is it?
perimenopause.
Yeah.
And also, it's really difficult to disentangle what's going on. So it's not so it's what we call a clinical diagnosis. It's there's no tests for it. You just have to kind of make it on, talking to people, which is very difficult to do when you're a GP in a 10-minute consultation. You've got
Mm.
18 patients that morning, and someone comes in going, I'm feeling a bit tired and slightly anxious, and I don't know whether it's my hormones. It's really, really hard. And again, we've only really been thinking about it for the last 5 years or so. Before that, no one was really talking about it. And the women that we were seeing were postmenopausal. They were women coming
Mm.
in going,
and
I've got
that
hot flushes, my periods have stopped.
and the whole HRT thing, there was a massive stigma about it not being a good idea. I
I think it was
remember,
going to maybe exacerbate cancer, breast cancer, but I don't
yeah.
think there was anything proven
No,
about that. And
initially though, wasn't there? Like years ago, it used to be like, oh, why would you go on that?
are you
Whereas
finding
now
more
it's quite
women are going on
common.
HRT?
So we're seeing, so basically what happened is that HRT actually was pretty popular before the early
Yeah.
2000s. So a lot
Yeah.
of women did take it. And again, these were mainly postmenopausal women or women in the last few years of
Yeah.
their reproductive life, as we call it. So what happened then is there was a big trial that came out in 2002, which showed that if you do take HRT and you take HRT long term, it does increase your risk of breast cancer. So we know
Yeah.
it does increase the risk. And then literally women were just taken off it overnight. And I was a junior doctor at the time, I remember this really well. And we just see women in clinic who were just terrified. And so they all stopped. And it
Mm.
just, if you look at prescribing, it just goes down like this and everyone
Gosh.
stopped.
Yeah.
And then the MHRA put a big warning on it saying that we weren't allowed to prescribe it. It only was for women with debilitating hot flushes and
Right.
only for 5 years. And then it had to be stopped. So essentially, we all became really out of the habit of using it. No one wanted it. And then what happened gradually over the last 10 years is
Yeah.
that firstly, newer preparations have become available, which are lower risk. They're still not no risk, but they are lower risk. But also, we began to realize that it's about balance. So there are other things that cause breast cancer, like drinking a glass of wine every night. That's about
Yeah.
the same risk as taking
Yeah.
HRT. And so we
Crazy.
know that there are lots of different, it's about a risk benefit balance. And what we really want is women to get good information and so they can make a decision for themselves about
Does.
what they
Yeah.
want to do.
Is
Cool.
there other alternatives to HRT, or is that like for anyone
So, well, it
suffering
depends what you're
symptoms?
treating. Yeah.
Mm,
So it depends what you're treating. And it depends what symptoms people have. So some symptoms, so things like hot flushes and night sweats, we know do respond really well to HRT.
Mm.
Things like anxiety or tiredness, there are multiple different causes for that. And while some women will feel better on HRT, it's not the holy grail. So there
Of
are
mm,
course not.
other things that we also need to be really in midlife looking at lifestyle. So we need to be looking at diet, exercise,
Mm.
sleep, bones health, all of these other things. And so, although HRT is what we use most, there are other things that we can use for symptoms. And we use these especially in women who've had breast cancer, for instance, and can't take
mm.
HRT.
Yeah.
But also, it's a holistic thing. We need to be really concentrating on keeping healthy, moving your joints, eating
Good.
healthily, looking after your
The
heart, all
sleep
of these
thing,
other
I've
things as well.
Sleep thing.
yeah, the sleep thing. I know friends they all say something like the 3 or 4 o'clock wake up or something. It seems to be a regular thing with people
Yeah,
going through
that's
it.
exactly it. It's that. And Zoe Shadell, who is the other doctor I work with at Myla
Yeah.
Health,
She
is a
talks
sleep
about sleep,
specialist. So
doesn't
that's
she?
her thing. Yeah. And we
Yeah.
see lots of
Ah,
women with sleep issues. And it is,
Gosh.
we know about 40 or 50% of women will get sleep disruption in perimenopause and menopause.
Goodness.
It's absolutely that. You're absolutely right. It's the going to sleep. And then at 3, you go to sleep really easily because you're knackered. And then at 3 in
Yeah.
the morning, your brain wakes up and you can't go back to sleep again. And so
yeah.
you're
Mm.
just constantly, permanently, slightly knackered,
It's
which,
right.
given all the plates you've got to spin as a woman in midlife now, makes life very difficult for you.
So interesting. My question is it worth going on HRT once you've had menopause? at an older
So
age in your 60s?
again, it's really difficult. And we do see a lot of women now in their 60s and even 70s and 80s actually coming to see us
My
to
mother
talk
was.
about HRT.
Mm.
And it's about, again, an individualized risk benefit balance. So we know that most symptoms of menopause will go over 10 years. And those are definitely the hot flushes or night sweats.
Yeah,
And a lot of women will feel much better after that time. And then you kind of need to ask what you're treating, basically. So
of
we
course.
know that taking HRT over time reduces your risk of heart attack and stroke, but that only really applies if you start taking it near to menopause. We
Right.
also know that HRT can help your bone density, but again, there are other ways of doing that.
Of course.
But we also know that for some of the women we see in their 60s and 70s, they still have hot flushes and night sweats. So
Do
about
they?
60% of women will still have them in their
Goodness.
70s and 80s, and they can sometimes be really disruptive. And for those women, we say actually, if you want to take HRT, then just do, then we need to give you the safest type possible, but it's
Yeah,
about them knowing the risks and benefits, and that's an
yeah,
individual decision.
yeah,
I think the mad thing about menopause is it was such a secretive thing. It was something you just didn't discuss until
yeah.
more
Recently,
recently.
no one
And
talked about it.
I mean, my upbringing, my parents have never been particularly open about, stages in life, but that particular, I'd never even heard of it. There must be quite a few myths surrounding menopause as well, because people, obviously have to. I think these days got better because the information's out there,
Mm.
but I think there's probably from our previous generation, particularly, a lot of myths surrounding menopause. I just wondered if, you have people come in that are completely sort of misinformed or not prepared for it at all, or whether the information's improved that much now that people are very much better informed. What do you find?
I think that there's been a slight kind of pendulum swinging in terms of about 5 or 6 years ago, there was no information. And I think now there's almost too much
Too
information. I
much.
think it's
Yeah,
Yeah.
probably
really
scares
confusing for
people.
women. I
Mm.
think the wellness and supplement industry has gone really big on menopause. I mean, you
What,
get menopause,
collagen and all
you
that
get
kind of
Yeah.
stuff. Too
food, you get
much.
everything is so much, and there's
Too
no
much.
evidence behind the
That it
vast
works.
majority of these things and whether it works or not. And if you look at the trials, they're all kind of, we gave 10 people a free sample of our
Yeah,
stuff.
exactly.
They all felt better.
Yeah,
That's not
yeah,
a
yeah.
trial.
In a
And
week.
but generally, people are, firstly, there's a combination between everyone, being overwhelmed in their
Mm.
40s and 50s, and then also thinking, I really need to start thinking about my health. I need to make myself feel better.
Yeah.
And much as it would be lovely
Panic.
to sit and do loads of yoga and eat loads of amazing food, you're actually trying to shove fish fingers into your kids and run off to
Yeah,
swimming practice. And you
exactly.
don't have time to do all of that. So of
Yeah.
course you're going to turn towards a supplement. That's that is absolutely natural. But I think it's great that there's more information. But I think the problem is that there's a real risk of sort of making menopause into this terribly horrible thing that everyone has to dread. And that it's all we need to know. For about 25% of women, they will not get any symptoms of menopause at all. So literally their
5%. That's quite big.
periods stop and they are fine. They're
Yeah.
not all falling apart in the workplace. They are often really relieved to have their periods
Yes.
have
Yeah.
stopped.
Normal
It's
temple.
brilliant. They don't have this up and down of
Yeah,
perimenopause where your hormones are all
exactly.
over the place. And also, many women feel it's a real time of wisdom. It's a time they come into themselves. Their
Of
kids are a bit
course.
older.
Yeah.
They've just got a bit of, they're high up at work. They know what they want. They don't take lots of crap from people
Yeah,
anymore.
Yeah.
exactly.
So we need to be really careful that we're not saying that it's a terrible time for all women, because it really isn't. So,
Just
but
to
it is
learn
for
about your
some.
body a bit more.
Yeah, I think the health and well-being side I'm still
Teaching
interested
people
in
about their body
because,
and
obviously that's kind of my time of life at the moment. But I am interested in sort of the diet side of things and exercise and just anything else other than the obvious HRT that is helpful for women going through that stage in their life. Can you give some sort of recommendations or any advice on that?
So absolutely, and the key thing is that it's actually much more simple than they make out online. So the only evidence we have about diet for more or less anything is a healthy, balanced diet that contains lots of fruit and vegetables, lean meat and fish,
mm,
whole grains, reduced UPFs, and that is literally all. There's no
gosh.
evidence about anything else, and that's all you
Reduced
need. You
GPS.
don't
And
need to
what is
take.
GPS?
Sorry? Oh, it's
What,
UPF. I mean,
yeah.
so ultra processed foods,
Ah,
basically.
Okay.
So
So
okay.
like
yeah. So
salamis and
just sort of,
hams
yeah.
and
So just
yeah.
not spending your life eating,
Yeah.
Junk.
cakes and
Yeah.
I don't know, sort of
Spanish
drinking
tapas. Yeah.
Coca-Cola, that sort of
Yeah.
thing. So just,
Yeah.
it's made very complicated online. There's like this, this
Too
diet and
much.
that diet,
Yeah.
but actually it is as simple as eating a healthy balanced diet
Right.
and not stressing too much about it. If you have the odd cake, it's fine, or
Yeah,
the
yeah.
odd glass of wine,
You need a
it's
bit of
also
sugar.
okay. That's what we know about diet. If there
Yeah.
was one thing that we would say to all peri and postmenopausal women, that they should do more of, it's exercise. So exercise is just,
And
not
what
only
kind
does
of
it help,
exercise?
so and again, it's just what the NHS says, which is ideally what we know in terms of reducing cardiovascular risk. It's 2.5 hours a week of aerobic exercise, and that's any exercise that makes your heart rate increase and make. I know no one does it. How can you if you
I mean,
work?
dog
It's
walk,
absolutely
but it's not like
it's
obviously not
impossible.
fast enough.
So just
So
a
basically,
brisk
getting your
walk, get your heart
heart,
rate up,
yeah,
feeling sweaty. That's the key
yeah,
thing. You
running
need to
around
be
an
feeling
airport.
sweaty.
Yeah,
Yeah,
What is
something
literally,
like
yoga
that.
and those kind of
that's
relaxing
Yes.
ones for
So there's
your
so there's
mental health?
the cardiovascular exercise, then there's strength
nutrition.
training, and we know that that's really important for
Pelvic
women as they get
floors.
into midlife. So yeah, exactly. So
Yeah.
strength training, so something like weights, and they say 2 sessions of that a week, and then the other thing is something with flexibility and balance. And so all of
Right.
the
Oh,
strength,
no.
flexibility, and balance is really, really, if you look at healthy old age, the stronger your muscles are, the longer you live in your own home, the less likely you are to fall over, all
Okay.
of these kind of things. So we're really moving. It used to all be about cardiovascular exercise and about aerobics, and that's what we know helps. We know that that
Right.
helps reduce
Strength
your
is
risk
so
of cardiovascular
important.
disease.
Mm.
But strength is
Make
really
me feel
important,
guilty.
Mm.
Crikey.
and all of this. So that's what we say. I mean,
Just
again,
heft furniture
Yeah,
around a
I
lot like
know.
me.
So
yeah,
I'm
lifting
really
Keep
interested.
it
furniture, lifting all
I'm
hamstring.
really
hands,
interested because
babies.
I've gone
Yeah,
through menopause. I'm interested in vagina health
That's our
yes.
next session.
because I would love to hear about.
We're going to have another one, and we're going to start another podcast in a few minutes. I have to cut
Okay,
that bit out.
so we're going to stop and then start another podcast and talk about vagina health because one leads to the other. Because a lot
Yeah,
of women my age, I'm 65. I want to know what happens next.
Mm.
I
yeah,
do know about
absolutely.
exercise, but honestly, the older you are, you don't want to exercise all the time. Walking the dogs is fun, running around. If you're going through airports and things like that, getting stressed, that's my exercise. But I
Yeah.
mean, all the younger ones, like my 25, 26-year-old daughter, they do all that going to the gym every day. I
I
can't
think you
bear
become
it.
a bit self-conscious when you get a bit
No,
older
it's
as
just
well.
boring.
Oh, it's
But
boring as well.
yeah,
Yeah, getting out in nature's
Although
good.
getting out in nature's great,
nature is
running,
great. So again, exercise is not only
doing it
good, and again, I'm
fast.
saying this as someone who never has time to do it either. It's not only is it good for menopause symptoms, but it is good for your bone strength. It's good for sleep. It's good for
Mm,
mental health. So we know that
mental
being
health.
outdoors in fresh
Yeah,
air is really good for
no
your mental
phone.
health. So
Yeah.
all of I mean, it reduces your risk of cancer, it reduces your risk of heart disease. So really, that is the kind of,
Being
and again,
amongst nature. Mm.
yeah, no,
Can I just
absolutely. Any of
can I
these things is good.
can I just ask, is dehydration related to menopause at all? Like feeling like you need to drink more? It's just
No, I
something
mean,
I've
a
noticed
lot
about
of people
myself.
do find as they do, obviously, a lot of people do find that when they go through menopause, that their skin feels a bit drier and but it's really different. And often people do find that they get a bit thirstier and have to drink more water. But again, whether that's related to menopause or just the trouble is that as well as going through menopause, we're also getting older. Horribly horrible as it sounds, but it's always
Mm.
really difficult to know how much is just normal. I mean,
Yeah,
definitely, I'm 51, and I've found that since I hit 40, like lots of little things start going wrong all the
yeah,
time,
yeah,
and they're nothing to do with hormones. That is
yeah.
literally just getting
Being
older.
older.
It's
I'm
just
glad
the
the
way it
brain
is.
fog is hormones, though, I have to
Yes.
say, because my kids keep saying, Mum, are you senile? I think you're having early dementia. Oh, thank you very
You forget.
much. Because I
Sometimes
forget a lot.
you're on overload as well.
Yeah,
Yeah, so
exactly.
you're absolutely
Multitasking
right.
all the
So it's
time.
not just hormones. Sorry?
Yeah, when I'm multitasking all the time, it is
Yeah.
quite difficult. And I've got 3 children and everything else going on. It's quite difficult. So I think actually I am finding it harder than normal. But yeah, they think I've got early onset dementia. So that's nice.
Thank you for that. That's fantastic.
Yeah, I've really enjoyed talking to you, and
Really, really
it's been
interesting.
really informative for me as well,
Thank you, me
particularly.
too, to pass on. Thank you so much for coming on this, and I'm sure we will have some many more conversations in the future. And to give the listeners your name and your company. I know one of the aesthetic nurses. She's a quite well-known nurse in Mayfield. Actually, she wanted to get hold of you. All her clients ask about menopause, so she's going to try and get an evening where she could bring all her clients from all around there to talk to you and to give out cards and come and see you. So,
Yeah.
there's a lot of people out there needing help.
Yeah,
It's
it's true. And
unbelievable.
it was amazing that we had you at our event.
Live is so much better than online.
Yeah,
So
exactly.
much better than just reading it. You're getting it from the horse's mouth. So thank you.
Thank you so much
We'll
for
see you
today.
again.
We will.
So thanks very much for having me on.